so you have decided to get a dental cleaning for your cat. The idea of putting your cat through anesthesia can be terrifying. You may also wonder, what are some potential complications during a dental cleaning? And how do you care for your cat after the operation? I am the cat butler, and recently, my ragdoll cats, Timo and Arya, had dental cleaning. And I wanted to share our experience and show you what to expect for the procedure. Before we start, let me quickly explain why cats need dental cleaning at the vet. As a cat parent, our goal is to protect our cat's gum and teeth. It is to prevent periodontal disease, which weakens the gum tissue around the teeth and can lead to costly tooth extractions for your cat. Cats need to have their teeth cleaned regularly because tartar builds up on their teeth just like people do. Tartar provides the ideal medium for bacterial growth because of its rough surface, which is easier for bacteria to accumulate. The bacteria then damages and inflames the gums over time and results in bone loss, gum recession, and the loss of teeth. In addition, when the pet develops dental disease, significant quantities of bacteria reside within the mouth and the oral tissues. These bacteria can enter the bloodstream and travel to other areas within the body, causing damage to the heart, liver, and the kidneys. For people who brush their cat's teeth, they may ask, do I need dental cleaning at the vet for my cat? And the answer is yes. It is true that brushing your cat's teeth daily is the single most cost-effective way to healthy teeth for your cat, as it effectively reduces plaque and tartar buildup. But it doesn't get all the tartar. What brushing your cat's teeth does is it reduces the number of times you need to go to the vet for a teeth cleaning. For example, I brush my cat's teeth twice a day daily, and there was still a bit of minor tartar on Timo and Arya's teeth. So getting a dental cleaning for your cat once in a while will completely get rid of all the tartar. Now that we understand why dental cleaning for your cat is important, let's walk through the process. When you first go to the vet, they will do a dental exam.
That actually looked really good. So calculus score 0 to 1, gingivitis score, not a lot of gingivitis that I'm seeing, 0 to 1.
The vet will do a visual exam and look at your cat's teeth and gums to see if a dental cleaning is needed. One of the things they look for is gum inflammation. Healthy gums should be a pink color and not an angry red or pale pink hue. The other thing the vet looks for is any discoloration or tartar on your cat's teeth. It would look like this: a yellow, orange, or brown buildup on your cat's teeth. If any of the two is spotted, a dental cleaning for your cat would be recommended. Timo and Arya had minor tartar buildup on their teeth, while Timo had some staining on his teeth that resulted in a brown discoloration. The vet assessed Timo and Arya's gums to be pretty healthy and thought their teeth overall was pretty good. I still decided to do a teeth cleaning because I want to be on top of Timo and Arya's dental health. I want them to have their teeth when they're old, and I know how fast the health of a cat can change. One day they are healthy, and the next day they have a health issue. So I decided to go forward with it. It also helped that February is National Pet Dental Health Month in the United States. If you do a dental cleaning during February, most vets give you a discount, which can help you save some money. After confirming that your cat needs a dental cleaning, the vet will do a blood test on your cat. This is a pre-anesthetic blood test to ensure that kidney and liver function is healthy enough for anesthesia, while older cats may need an electrocardiogram for the heart as well. Most vets agree that the biggest concern about dental cleaning for a cat is anesthesia. There is a risk that your cat may die. That is why a blood test is necessary to reduce that risk and help catch pre-existing health issues that would deem your cat unsafe to undergo anesthesia. You would want to do this blood test as close to the dental cleaning as possible to have the most up-to-date results. For Timo and Arya, they got a blood test a week before their scheduled cleaning, and fortunately, the blood work looked good. Why do we need anesthesia for dental cleaning? Cat dental cleanings closely resemble those for humans. Anesthesia is necessary because unlike us, your cat will not willingly hold their mouth open on their own. They may also bite. Moreover, placing a tube down the windpipe while your cat is under anesthesia keeps the airway safe from water used during the cleaning. Another reason for anesthesia is that dental cleaning can be painful. Working on your cat's mouth awake would lead to unnecessary discomfort and trauma. When your cat is unconscious and asleep, they will be largely oblivious to any oral pain. Therefore, anesthesia keeps both your cat and veterinary staff safe during a dental procedure. For the longest time, I was hesitant about doing a dental cleaning because of the anesthetic risk to Timo and Arya. They are my children, and I wanted to make sure I did all the research. Even though the risk of death from anesthesia is 0.1%, I wanted to find a vet with a good track record I could trust to do the operation. In the end, I found one that was very knowledgeable and would treat my cats, Timo and Arya, as his own. I knew I was in good hands. Can we do dental cleaning without anesthesia? The answer is not really. Trying to restrain a scared cat for a long time while the vet uses a sharp object in their mouth is a recipe for disaster. Not only does it cause trauma for your cat, but it is impossible to clean under the gum line, where the bacteria that causes periodontal disease occurs, without anesthesia. As a result, anesthesia-free cleaning is a cosmetic procedure only and doesn't remove the root of the problem. Therefore, it is not a recommended option. If you enjoyed this video so far, please consider subscribing and hitting that notification bell. We make videos on helping you become the best cat owner, so please join us. On the day of the procedure, you will be told not to feed your cat the night before. The reason is patients under anesthesia lose the ability to swallow. So if there's food in the stomach, the cat could vomit under anesthesia and have vomited material enter the lungs, which can be a life-threatening situation. Once you hand over your cat to the vet, the first step they will do is place your cat under general anesthesia. Your cat will be given a pre-medication 30 minutes prior to the anesthesia to help decrease stress and anxiety. Anesthesia is then delivered via an IV catheter, so your cat can be closely monitored to ensure their heart rate and rhythm, respiratory rate, and blood pressure remain stable. Special measures will also be made to ensure your kitty is kept warm during anesthesia. Administering anesthesia via an IV catheter is the safest and most reliable way, so make sure your vet uses this method. After your cat is asleep, dental x-rays are taken. X-rays are necessary to help your vet determine if there's tooth decay or bone loss under your cat's gum line. This radiographic evidence can guide your veterinarian on whether or not a tooth needs to be extracted. After that is done, the gum around each tooth is gently probed to find any deep pockets that may point to a receding gum and indicate that the nearby tooth should be pulled. Luckily, Timo and Arya had healthy gums and did not need any teeth to be extracted. Now, the vet will start scaling your cat's teeth. An ultrasonic scaling device will be used to clean under the gum line and scrape at the tartar and plaque buildup above the gum line. The act of scaling the teeth can create microscopic scratches on the surface of the tooth, where bacteria may hide away in the future. Polishing the teeth smooths out these scratches and prevents bacteria from adhering to the tooth, making it more difficult for tartar to come back. Their teeth look beautiful. Once the procedure is deemed complete, the vet will then wake up your cat from anesthesia and monitor it closely as it recovers.
And Miss Aria, she's just enjoying her drugs in a different way than Mr. Timo.
The entire dental cleaning procedure takes about 45 to 75 minutes.
Timo, that's the boy portion. The cute boy.
Oh, you're ready to go home already, huh?
Got the rub.
After the surgery, your cat will still feel groggy from the anesthesia. This feeling should go away over the next 24 hours. For the first day, cats may also have trouble eating, so don't be surprised if your cat won't eat during mealtime. Timo and Aria were glad to be home. Timo was super hyper, and he wouldn't stop wrestling with his stuffed animal Kirby. He also thought he could do his normal jumps, but a lot of the times, he would miss horribly. I recommend keeping an eye on your cat their first few hours back, so they don't hurt themselves. So how much does dental cleaning cost? The entire procedure roughly costs $1,000 per cat without a discount. This is usually what the cost is for a higher cost of living area. I had pet insurance, so it helped cover 90% of the cost. So how often should your cat's teeth be professionally cleaned? Cats should have professional teeth cleaning at least once a year to remove plaque and tartar buildup, regardless of their breed, size, and age. This was Timo and Aria's first teeth cleaning, and I should have gone sooner. In between teeth cleanings, you should brush your cat's teeth daily, as this will ensure good dental health. I have found using a small toothbrush and having something to support their back, like their cat bed, helps make brushing their teeth easier. If you want to learn how to brush your cat's teeth, or use the toothbrush I use, I'll link it in the description below. I hope this video helps clear up any questions you may have. Comment down below. What is your experience with dental cleanings?